right, let's talk about the rate of vaccinations. Why have we gone from between 80 to 60 lakh vaccinations a day and in the last few days of June to a middling 30-35 lakh vaccinations per day? Now, here's the question, because states are beginning to say that there is a shortage of vaccines coming to them, and that's why some of them have to close centers. It's turning into a political fight. The new health minister has come and said that that's absolutely not the case, and enough doses have been provided to states. In fact, 13.5 crore doses have been provided for the month of July, says Mansukh Mandavia, the new health minister. Now, this figure of 13.5 crore for the month of July is an important one. From the central government's perspective, it shows that they are telling states in advance what vaccinations they're going to get. So they should really plan their allocations and make sure they don't have to shut centers or, have long queues waiting, etc. But on the other hand, it also underlines why we're seeing low vaccination rates. Remember, the target is 1 crore vaccines being given and delivered a day to people. So that means 1 crore vaccines a day in every person's arm, so that we cross the threshold of vaccinating all adults. Even if I bring that to 70 to 80 lakhs a day, clearly with 13.5 crore available in July, we're going to be very short of that figure. So is this a supply hitch? Is this a management hitch? Or is there an element of vaccine hesitancy behind the decline in numbers? To speak on this, I'm joined today by Viren Shetty. He is ED and Group COO of Narayana Health. Dr. Rajib Dasgupta, National AEFI Committee member, also joins us on the show. And I'm also going to be speaking shortly to Professor Vaccination Gupta, who's a member of the NEGVAC, the agency that advises the central government on vaccine management for COVID-19. So welcome to all of you, and thank you so much for speaking with us. Let me begin, Dr. Rajib Dasgupta, by getting your view. Why do you think we've petered off in the last couple of weeks? Is it simply a supply constraints issue? Because remember, the supplies were supposed to bump up from the month of July. That's what everyone was saying, that from July the whole story will change. Why has that not happened in your view?
Thank you. I wrote in my Financial Express column on 22nd, which was the day after the 21st June feat, that one hopes this, which is the 90 lakh odd figure, would be the new normal and not an uptick or a surge. But unfortunately, it did turn out to be an uptick or a surge on that day. What's quite clear now is that at least in the next 3 to 4 weeks, the supply situation is probably not going to change. This is something which we'll have to settle for at about a max of 3.5 to 4 million vaccinations a day. But then vaccination is important not just for the economy to revive, but for all other activities to revive. Even as figures come in over the last year, surgeries have been about half. So non-COVID health services such as surgeries, such as those on chronic medication like antiretroviral therapy, antituberculous therapy, all of those have to get back to normal, as has got to be economy, livelihood, etc. And therefore, vaccination is extremely central to all of this. You touched upon hesitancy, but it seems to be the case at this point that it's more of inequity rather than hesitancy. The hesitancy has been addressed to a large extent. All vaccination programs do cope with hesitancy. We will cope with whatever there is. But at this point, inequity seems to be the larger problem.
So you're saying, just as a follow-up, Dr. Dasgupta, it's not an issue of only supply constraints. It's not that people don't want to take the vaccine. You're saying it's not equitably available. Is that the problem?
Well, a much forgotten document of the WHO now is what's called a value framework. So at the outset, when the vaccination program was being conceived of globally, the WHO actually set out this prioritization and allocation strategy in terms of vulnerability, both to address vaccine equity at the global level as well as at national and subnational levels. Now, we are just keeping track of mere numbers, but what's happening within, who are getting these numbers? If, for example, a larger share of vaccines are being administered through the private sector. What does it mean? Who are the population groups who have perhaps a more privileged access than others? Those things are also going to matter as far as equity within populations is concerned, and therefore who is getting benefit even when there's a supply constraint. And what we have seen in May, for example, which was really the crunch month, as the Reuters analysis showed, that 9 metropolises actually immunized more than what the entire group of EAJ districts, which is about 114 odd districts, actually immunized. That shows quite deep-rooted inequities.
Viren, it's an interesting point about the private sector, because the Health Ministry put out a notification yesterday which talked about how vaccine rates or vaccination rates have gone down through private centers, and they listed a number of reasons. Some of them was that orders were not being placed properly, or full payments were not being made, or if vaccines were being delivered, they weren't picked up, and there seem to be a lot of supply chain issues. What has been your experience? Has the number gone down? Has the demand gone down from those who wanted to go to the private sector because perhaps they've already got their jabs?
Yeah. So picking up from what Dr. Dasgupta had mentioned earlier about the first phase of vaccination starting in May, when it opened up, being primarily concentrated in the big cities. That's essentially where all the distribution hubs were. That's essentially where all the people who are most likely to pay whatever it took to get the vaccine done did. And so you had this huge uptake in the first month of May and going well into June. What we face now is a combination of all the things you mentioned above. There's not enough vaccines, that is true. There's a little bit of hesitancy, that is true. There are not enough centers doing it fast enough, that is also true. Maybe people are more complacent about it, that is also true. All these factors are counting into it. Now, there's very little we can do about it. To be honest, see, we have to count ourselves as one of the most privileged third world nations for at least having vaccine manufacturing capability. God forbid we were a country, let's say any African country, which is completely dependent on countries like the EU or Russia or China to supply them, you're completely at their mercy. So we have something. Now, obviously, it is riddled with inequity, and there's a huge issue with privileged access and so on, but a large number of Indians did at least get 1 dose of vaccine. So it's something that could be improved, but we're learning as we go. There are a lot more vaccines that have come up. A lot of companies have started rolling out different modalities of vaccine. The Novavax vaccine has come up, which I believe is very promising. They will start opening up mRNA vaccines as well. We just have a lot more options to choose. But to expect all of this to have been done in a 6-month target, which was vaccinate the whole country by the end of this year, maybe was what in the corporate world we call a stretch target. You do it on the assumption that it's not going to happen, but it gives you something to aim towards so that we pull out all the stops and do everything we can to get somewhere towards the goal. So people can revise their estimates of what the manufacturing capacity should be, that citizens get more excited about getting vaccines. So institutions like ours and the others did everything they could. And now we're faced with the shortage. All those who were desperate to get it, got it. And now is the slog. This is where you have to go out into the countryside to get people to get vaccinated. This is where you have to send multiple reminder calls to people who've gotten their first dose but have not yet imagined that they would have to come again for the second dose. So this is hard work. And this is the process we're all involved in right now.
No, so let me get this clear, Viren. From what you're experiencing right now, by the way, 33% of the country has got their first dose, and that's a big deal. That's quite a large number. 8% have got both jabs. It would be better if it were a much higher number, but in absolute terms, it is large. All of that is given. The fact is, we need to vaccinate more people. There's no doubt about it. But Viren, I want to understand, so what is happening? You're getting the doses, but people aren't coming. Is that the case?
No, I mean, those are two very different statements. We are getting the doses. We're not getting as much as we want. We're not getting it in the quantity that we want, but we are getting doses. And people aren't coming because all the people within the vicinity of the place where we have doses are already vaccinated. So this next phase is for us to go out to where people are who don't have vaccines. And that means going out into the rural areas, organizing camps, doing free vaccines, and those are the things that take a lot more time. So as long as people were coming to our hospital, at a peak, we were able to do 4,000 vaccinations a day in a single campus. Now it's slowed down, of course, because not that many people are going to make the effort to come to any large vaccine center. We have to go out to them. And this is something every country across the world is suddenly realizing, that it's not just about creating a vaccine center. You need to create vaccine vans. You need to create a whole army of people going on foot to the villages and rural areas and vaccinating people. And that is something that will take time.
So we are, this is an interesting idea, and I think very aptly describes the situation in. It's not so much about lack of supply, though of course we need to bump up the supplies. Sputnik has not taken off the way it was supposed to in terms of the quantity we were supposed to get. Moderna, Pfizer is still hanging fire. We don't know when it's going to come. Novavax is still on the horizon. All of that is there. So we're still dependent on Covishield, Covaxin. The new makers of it will take time to get all of the supply on board. But it's also about going to people now and vaccinating them. Dr. Dasgupta, your views on this. Those who were aware enough or had an immediate requirement went and searched out the vaccine. I mean, in the peak of, when all of this began and it opened up for 18 plus, there were people traveling over 100 kilometers in a day from big cities to go into rural areas and get a vaccine. So that fever has now subsided. Viren is talking about now going to people's doorsteps to vaccinate them. Do you think this is where we're lacking and this is what we need to do next?
Yes, I think Mr. Shetty has been very candid in his assessment, and that's absolutely bang on. Now, Mumbai, for example, there are centers which have huge capacities, but which are lying underutilized, not only because vaccine supply is constrained, but also, as he says, that people are after all not going to travel 100 or maybe 50 odd kilometers to get a vaccine, even when there's a certain amount of demand. What he's telling us, and I'm sure he's right, that the urban has indeed got saturated. In fact, if you see the 60 plus and 45 plus coverage with at least one dosage, that's in the range of 50 to 60%, which means that where are the remaining ones left? Obviously, there are those who are away from the current vaccination centers. And to be fair, all states are now making, in fact, over the last 1 month or so, have been making outreach camps and efforts to make it more and more outreach based. But that is, again, as Viren very rightly said, that is extremely human resource and time and other resources intensive. And therefore, at a certain level, this is a relatively expected slackening unless there is greater mobilization of the provider side teams. But then you would make that mobilization only if you had an assured allocation strategy and a supply chain. There probably, I'm just saying probably from the, if you take a view from the bottom, from the district immunization officer's vantage point, probably there isn't enough vaccine in the pipeline that he or she can rely upon and actually mobilize very large numbers to vaccinate. The foundations of the immunization program in this country are very deep. We have on umpteen occasions proven capacity to immunize very large numbers, whether it's polio or measles. They may not necessarily be comparable vaccines, but the foundations are strong enough. But then you would mobilize that force only if you have an assured supply and you can plan for weeks rather than for days.
Yeah. So in light of all of this, Dr. Dasgupta, when do you think we're going to end up vaccinating, a majority or all of the adult population? And how crucial is that right now, considering the resurgence possibly of a third wave and more variants which will escape vaccinations?
Well, again, these are slightly unlinked questions in my view. Well, the first, I'm not going to hazard any guesses. We'll have to see how it unfolds. because it's based on a complex set of factors. But how vulnerable districts and states are will be informed to a large extent by the district level sero surveys that the ICMR is undertaking, that's under progress. And as we understand, results should begin to come in soon. That will actually give us an idea of vulnerability in terms of seroconversion or protection, either from vaccines or from natural infections. And therefore, depending on the vulnerability of districts and states as they would emerge, we may need to take a relook at the vaccination strategy, prioritize some, and perhaps reallocate supplies to the extent that they're available.
Thank you so much, Viren, as well as Dr. Dasgupta. I'm joined now by Professor Vaiki Gupta, a member of NEGVAC, to understand more on how the organizational side of this is working and how the central administration is looking at the vaccine issue. Professor Gupta, the basic question, why are we stuck right now around the 30 lakh a day mark when we have shown we have the capability to vaccinate as high as 90 lakhs a day?
See, I would say that the government is putting all efforts to increase the vaccination, and now almost every day the target was, of course, nearly 1 crore vaccine per day, but now we are, as per the figure which is being given, we are reaching about 30 lakhs plus vaccination every day. And the government has sent more than 13 crore vaccine shots to different states, and this vaccination is in progress. But we all know that the vaccination process is now slightly slowed down. And I would say the reason could be three. One is, or people are thinking the reason what could be the reason? One reason could be the availability of the vaccine. I would say this is not the issue today. The vaccines are available from different sources. We have COVID vaccines, Covishield vaccine, now Sputnik has also come, and soon the availability of Moderna and Pfizer would be there, but soon. Now, this will gradually improve the situation of availability. The second important thing is the management of vaccine administration. This has to be very well coordinated between the state government, the central government, and the hospitals and the centers. It requires a larger degree of participation and mutual understanding and involvement so that the people have ease of going and not waiting, and unnecessarily the negative effects should not be there. The third thing which is within our control is vaccine hesitancy. Still, there are lots of people who give unnecessarily negative image of the vaccine, which is not only unethical, which creates a negative impact on the control of the COVID-21. And today I would say the impending the third wave. So we have to still educate the people that no hesitancy should be there. Those who have
that's fine. That's fine, Professor Gupta. Vaccine hesitancy is an ongoing issue, but I want to specifically understand why we've had a drop in numbers. If it was all about vaccine hesitancy, then you would have possibly have had oversupply and less people coming up for it. There is no real, anecdotal evidence of large number of vials going waste because people don't want to get vaccinated. What is being said is that private vaccination numbers are going down. Do you see that as one of the reasons?
The state government and the central government are giving vaccination free of cost, and therefore people would prefer to going to the government hospitals and get the free vaccination, and therefore the vaccination in the private center may be a second preference, and that may be the reason why the private sector is doing less vaccination. But many people still want to go and get done because of the more comfortable, less line, less time in the vaccination. But definitely, if somebody is getting free of, then that will be the first preference.
Yeah, but that still does not explain why numbers have gone down to, nearly 90 lakh on the June 21st. After that, 50, 60 odd lakhs, an average of 60 lakhs that whole week, and now are down to 30 lakhs. If people want to go to government centers and it's available, then why are they not going there?
We have to look for what best can be done under this situation. There are couple of the private sectors, the public sector, hospital, the laboratories, pharma sectors are now roped in to manufacture vaccine. Now, this will take some time, maybe 6 months' time, and that is what is the fastest possible 4 to 6 months. And when after 4 to 6 months, more number of vaccine companies will be pouring in their vaccines, and also Covaxin, Covishield, when their vaccines will be doubled, when Sputnik production will also be started by Bharat, by Serum Institute, then when there is a plenty of vaccine shots will be available, and then the management of the vaccine distribution will be strong and tough, I think we will suddenly logarithmically get increase or exponentially increase in the vaccination rate.
All right. Let's hope that all of these issues get sorted out and we do increase our pace of vaccinations. We really can't afford to be stuck in this middling figure of 30 to 35 lakhs. It's much better than in May when we were at around 20 lakhs, but we've shown we can do much more. So let's go ahead and do it. Perhaps the time has come, as was suggested, to go to those who need to be vaccinated.